I'm Dr. Patrick McCarthy. I'm director of the Bloom Cardiovascular Institute here at Northwestern, and I'm also the chief of cardiac surgery.
Hi everybody, it's Adam with HeartValveSurgery.com. I'm here with Dr. Patrick McCarthy of Northwestern Memorial Hospital in Chicago, Illinois. Dr. McCarthy, can you tell me what kind of cardiac surgery you specialize in?
My practice of cardiac surgery has changed a lot over the 22 years since I finished my training. I used to do a lot of heart transplants and mechanical devices, and eventually I've evolved that now 90% of what I do is heart valve surgery. About half is aortic valve surgery, about half is mitral valve surgery, and just like today, many patients are very complex, needing a second or third operation, and sometimes 2 or 3 valves together.
What attracted you to valvular surgery?
I love valve surgery. You can really fix things. Really, fundamentally, a simple mechanical problem. You get a valve that, is supposed to open like this, and instead it barely opens, and you put a new valve in there, and it restores normal functions.
Is aortic valve disease common among your patients?
Aortic valve disease is very common. In particular, a lot of patients are born with bicuspid aortic valve disease. It's about 2% of the population. Of all the aortic valve operations, about half are patients that have bicuspid aortic valve problem initially. And of those, about a third or half also need an aneurysm fixed at the same time.
Could you explain what a bicuspid aortic valve is?
So a bicuspid aortic valve is fairly common. About 2% of patients have it, and it really forms in utero. There's only 2 leaflets instead of the normal 3. That's where the bicuspid word comes from. In about 2/3 of patients, it doesn't act up, and so they live out their life, and the valve is functioning fine. In the other group, it may either form stenosis, meaning it calcifies and it doesn't open, or it may leak, and we call that aortic regurgitation, and that's the group of patients that may need surgery. So when patients have a bicuspid aortic valve, we're also alert to the possibility of an aneurysm. The aorta is the big blood vessel that leaves the heart, and in that group of patients, the wall can be somewhat weak and it can expand, and then aneurysms cause no symptoms until they do something bad like rupture or dissect.
So Dr. McCarthy, we understand that you recently launched a bicuspid aortic valve program at Northwestern. One of the questions I have is this common for a cardiac center to have a bicuspid aortic valve program?
No, this is actually a unique program in bicuspid aortic valve disease. In fact, we think that it is the first in the country that we've heard of. So the objectives of the program were to really offer sort of the whole gamut of care to patients, but also research. And so it includes our partners over at Children's Hospital that just moved, so that they're about a block and a half away from us. And so it involves screening family members, which is very important because it's so common in families with this. And so it is recommended that first-degree relatives, which would be brothers and sisters, parents, or children, should have screening starting with an echocardiogram. And it goes through clinical care and research such as imaging, 4D MRI, but also basic science, like what's the pathology of the aortic wall.
Who else is working with you on this program?
So here at Bloom Cardiovascular Institute, we really practice team sports. And so with the bicuspid aortic valve program, there's a team of physicians and nurses that work with this. An important first member is Colleen Glennon. Colleen is our bicuspid aortic valve nurse. And then Jyothi Puthamanan is the cardiology medical director of it. My partner, Chris Malazri, is another surgeon that is mostly involved with this. And then over at Children's Hospital, we have people such as Luciano Young, and there's really many more. So we actually put together a very big team to help tackle this problem.